What can I do so people understand my English better? Hi, I'm Claire from Accent and Communication, and I have 7 simple steps to help you be better understood when you speak the first time. Number 1, slow down. Slowing down your rate about 10 to 20% will help others better understand you. This doesn't mean using a robotic, choppy voice and having pauses between each of your words. I'll talk about that a little bit more in a minute. It means slowing it down so that you match the speed that I'm speaking at. You can find a speaker that you admire. Time how long it takes them to say maybe 1 or 2 sentences, 3 sentences. Record yourself saying the exact same words, same sentences. Compare your time to that speaker's time. Are you speaking that much faster? If you are, that's a sign that you should slow down. Slowing down is actually a good thing. It keeps people's attention, and you should be comfortable doing it. And realize it helps your listener understand you. It gives them thinking time. It gives you thinking time to know what to say next. The power of the pause. Pausing is so important. People might think that pausing means weakness. You don't know what to say next. It's the opposite. When you pause, you hold your listener's attention. It gets them waiting for the next part that you're going to say, like I just did. You want to maintain eye contact, make them know that you're going to continue, and they'll listen and wait and think, what's next? What has she got to say next? What's so important? Pausing really is wonderful. If you listen to those speakers that I mentioned earlier, you'll notice they pause a lot to get your attention. So don't be afraid of it. Make sure you use it because it's an excellent tool for you and for your listener. Gives you time to figure out what you're going to say next and how to say it. It gives them time to understand it, and it holds their attention waiting to hear what you have to say next. Number 3, connect your words. Do not speak like a robot. You want your words to flow together. The ending of one word joins the beginning of the next word. The sounds can meld together. There are some languages where words are spoken more choppy. We're not like that in English. We flow. Our words flow together. For example, the sentence, take your pills at night. Not take your pills at night. Put them together. Take your pills at night. Especially when you get to pills that. I didn't say pills at. It was pills that. One word, pills that. And the at, the T in at, is made in the same place as the N in night. At night. They stay together. Pills at night. When we speak in English, it's like just one long word. And that's how it flows together and just sounds more natural. Stress the key words. In English, we stress nouns and verbs, the important words. We make them stronger. We might rise in our intonation. They're powerful words, and we gloss over the little words. We say them, but they're just kind of there. For example, we've got take this medication with food. That's pretty equal stress there. Take this medication with food. You want your patient to understand it? Take this medication with food. It's a little louder. I said it a little bit longer, and it just brings their attention, the listener's attention, to those words. The other words weren't as important. They're important in English for grammar, for sounding good, but we don't focus on them. Number 5, use shorter, simpler sentences. If you're in the medical profession, doctor, nurse, pharmacist, it's important to realize that I, as a patient, am vulnerable. I've got high anxiety right now. I'm not familiar with your vocabulary. That affects how well I can understand you. If you take a longer sentence and break it down into shorter sentences, It gives me processing time, time to absorb what you said, and then be ready for the next sentence you give me. For example, I have a very simple sentence here. You need to make sure you take this medicine before meals and avoid eating fruit after. That can be broken down into take this medicine before meals. Don't eat fruit after. 2 shorter sentences. I've had time to think about it, understand both of them. I'm good to go with how to take this medicine. Number 6, confirm understanding. It's easy to say, do you have any questions? Well, most likely I do. I have a lot, but I'm not even sure how to ask them. I'm not even sure where to begin. You could ask a confirming question that helps you gauge how well your listener understood you. Ask them to restate how they're going to take the medicine. Can you tell me how you're going to be taking this medicine? And this is especially true when you've got a more vulnerable patient, maybe somebody who's a little bit older or somebody younger that's not there with their parent. They might be late teens, early 20s. They're in the doctor's office for the first time on their own. You know all these different kinds of patients that seem to be a little bit more vulnerable, a little bit more nervous. Maybe this is their first time in the doctor's office, or you're presenting some very complex, frightening information. It's important to ask the patient more open-ended questions where they have to come back to you with the information so that you can confirm how well they understood what you said. Replace more difficult words with simpler words. I'm not talking about dumbing down your conversation and insulting your patient, but you probably will use more complex vocabulary than we're familiar with. You could introduce something and say, when I say this word, it really means abdomen, belly. So you can explain that at the beginning and then use the more simplified words. I know as a patient, I'm going to go home, get in my computer, look it up and say, what did the doctor tell me? And then I'm going to have all these new complicated words to look at. So you want to make sure that you explain those words to them. But when you're talking to them, to that patient, to that vulnerable person, use the simpler language so that they can understand it. Again, this all comes down to patient understanding here, which is your goal, that when you're communicating, they understand what you're saying. We've got this example down here. Administer. You can use the word give. Consume. Use the word eat. Simple words, and they're just common words that we use every day. And that'll help us as a patient understand you better. Earlier, I was referring to finding a good speech model. What you should look for is a person who uses a slower rate and uses pausing. You can find your own speech model by deciding what characteristics you want in speech. Some descriptors you can use when you're doing a search are confident, relaxed, soothing voice, smooth pacing, engaging, dynamic, sympathetic. Those are just some characteristics. You need to figure out what you want to sound like and use those characteristics in your search to find a good speech model. Here is a list of a variety of speech models that I feel are very good. Each has its own different characteristic. This is by no means an exhaustive list. You can identify maybe 5 or 10 words or phrases that you use every day. Listen to how native English speakers pronounce them, and then practice imitating them. Remember to listen for stress, connection, and pausing. If a friend or colleague agrees, record their pronunciation, hopefully in a sentence, so you can compare it and try to imitate it. Just a few changes on words you use regularly can have a very large impact. Here's a 5-minute drill. Take those words, phrases, and sentences that you've already worked on and practice them every day by slowing down, stressing key words, connecting your words, simplifying and shortening what you're saying. Practice various confirming questions that you can ask. I'm Claire from Accent and Communication, and I hope my tips help you feel more comfortable speaking English.